Plantar fasciitis is a common foot condition characterized by inflammation of the plantar fascia. Plantar fascia is a thick band of tissue that runs across the bottom of your foot and connects your heel bone to your toes. This inflammation typically leads to a heel pain, especially with the first step in the morning out of bed after a long period of rest. I'm Dr. 𝘠𝗂𝗧𝗏𝗏𝗏, a board-certified foot and ankle surgeon. Here on this channel, I educate you on foot and ankle conditions and treatments. What are the most common causes of plantar fasciitis? Plantar fasciitis occurs due to repetitive strain on the plantar fascia. This strain can result from various factors, including overuse, such as activities that involves prolonged standing, walking, and running, which can excessively put stress on the plantar fascia. Poor foot mechanics. Flat feet or high arches or abnormal walking patterns can contribute to uneven distribution of weight and strain on the plantar fascia. Footwear. Wearing shoes with inadequate support or improper fit can exacerbate the condition. Obesity. Excessive body weight can increase pressure on the plantar fascia. Women throughout pregnancy gain a lot of weight, and that also contributes to their plantar fascial pain. Tight calf muscles. Tightness in the calf muscles can affect the mechanics of the foot and contributes to plantar fasciitis. So how do we diagnose plantar fasciitis? Plantar fasciitis typically involves a physical examination in the office and a discussion of symptoms and medical history. Your doctor may perform a test such as an X-ray or ultrasound to rule out other possible causes of heel pain. How do orthotics help with plantar fasciitis? Orthotics provide support under the arch and reduce the pressure that is on plantar fascia. So by having an arch support, your plantar fascia will relax and starts the healing process. So when you're doing your stretching, your calf stretching, there's two muscles. There's gastroc and soleus muscle. So you have to do this stretching with your knee bent and with your knee extended. Both of these stretches are very effective for plantar fasciitis. Why? When you stretch the gastroc soleus muscles or your calf muscles, it reduces the stress that is on the heel bone. So the heel bone starts relaxing and the plantar fascia is attached to the heel bone. So when the heel bone is relaxing, the plantar fascia has less stress on it. Calf muscles are shorter. It's more stress on the heel bone, which tilts up and stretches the plantar fascia. So how does ice work? Everyone says ice is anti-inflammatory, but let's get into it and find out why ice helps. So ice helps because it's a vasoconstrictor. So applying cold causes blood vessels in the area to constrict. That means they get smaller. Reduction of the blood flow in the area decreases the swelling and inflammation. How does ice help your pain? So cold temperatures can reduce the ability of the nerve endings to conduct impulses. So they temporarily relieving pain. That means your brain doesn't get the signal that there is pain in that area. Ice also helps in reduced metabolic activity. What does that mean? Lower temperature decrease the rate of cellular metabolism. This reduction in metabolic activity can help to minimize cellular damage and reduce the body's inflammatory response. I know that's a mouthful, but basically it decreases the metabolic activity, so there's less activity in that area. So that's how the ice helps the inflammation. One more thing to have in mind about ice. Ice is most effective when it's used shortly after the injury. So long-term use of ice is not very effective. Rest. Limiting activities that exacerbates the symptoms can help reduce the inflammation and allow the plantar fascia to heal. Stretching exercises. Stretching exercises for the calf muscles and plantar fascia can help improve flexibility and alleviate tension. Proper footwear. Wearing supportive shoes with good arch support and cushioning can help alleviate symptoms and prevent recurrence. So when you have good shoes, they will support your feet from overpronating, which puts a lot of pressure on the plantar fascia. Night splints. I often recommend night splints for my patients that have plantar fasciitis. Wearing night splints that keeps the foot in a dorsiflex position, meaning an upward position, overnight can help stretch the plantar fascia and reduce morning pain. So when the plantar fascia is stretched at night, that means in the morning you don't have to stretch it when you put weight on it or overstretch it. This will reduce the injury that happens in the morning to the plantar fascia. Okay, if none of the above that I mentioned is not helping and you continuously having pain after 6 to 8 months, your doctor may recommend invasive approaches such as surgical treatments. One of the surgical procedures called plantar fascial release. This procedure involves partially cutting or releasing the plantar fascia to relieve tension and also reduce pain. This could be performed through a traditional open surgery or a minimally invasive technique, which has been very popular lately. Small incision, and you put a trocar in there and release the plantar fascia either totally or partially. 10X procedure. This is one of the newer minimally invasive procedure that uses ultrasound imaging to identify and remove the damaged tissue in the plantar fascia. Endoscopic plantar fasciitis. I know it's a mouthful, but this is a minimally invasive procedure that involves using a tiny camera and specialized instruments to release the plantar fascia through a small incision. Thanks for watching. Don't forget to subscribe and hit that notification bell. Your support means a lot to us and helps us grow this channel. Till next time, stay awesome, and I'll see you in the next video.